Aloha and welcome. I'm very excited about today's Facebook Live event because I'll be introducing a new cutting edge technology to the community. It's called NeurOptimal, and it works directly with brainwave patterns. And in fact, it actually helps to train the brain effortlessly while one listens to music or watches a movie. And we have with us here today Gail Crabb. She's a registered nurse and she has used it for herself personally and was so impressed that now she is using it for her patients. So just as a way of introduction for those of you who aren't familiar with me, my name is Dr. Catherine Taketa-Wong, and I'm a naturopathic physician, an ND. And like medical doctors, I'm required to attend a 4-year medical school. I was trained as a primary care physician, and I order lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there's a lot more. So the typical medical school offers about 19.6 hours of training nutrition. Naturopathic doctors, by contrast, receive about 155 hours of training nutrition in order to be trained in the power of nutrition to build health from the inside. And applying that knowledge to a patient's condition takes a lot more time than just prescribing pills. My office visits are a full hour. And in addition to that, I'm a licensed acupuncturist trained in Chinese medicine. And my goal was to educate myself as widely as possible because my passion is to help people not only get healthy, but to stay healthy. And I love caring for my patients and believe strongly in working with them as partners in their health and well-being. So in a moment, I will be formally introducing Gail. You can see her here. But she's a registered nurse, as I mentioned, who has used the NeurOptimal system and now has her patients using it. But I just wanted to let you know that as we go along, if you're interested in what NeurOptimal can do for you, or if you have a health condition you want to talk with me about, please call the office and schedule a free phone consultation. There's no charge because I don't take new patients without reviewing their situation first. And we discuss your health concerns, come up with a plan that would help you the most. And to schedule a free consultation, just call or text the office or click on the link in the post. All of the contact information is on our Facebook page. So now I want to turn to Gail and thank you again for taking your time to join us today and to share your experience about NeurOptimal and to share this really exciting technology. And so again, Gail is a registered nurse and she has years of experience in terms of working with patients, but the NeurOptimal is something that she's been working with in recent years. So I'd like to kind of turn the time over to you, Gail, with just kind of sharing a little bit about what, some basic questions like what is NeurOptimal? And if you can just share your personal experience with it, because that was what first caught my attention, was you just sharing your personal experience with it.
All right. First of all, I'm very glad to be here and to share this. And I do have what I consider a very life-changing, exciting story to tell because it's my own story. Yes, I've been a nurse for many years. I have 10 years experience in the emergency room. Oftentimes when it came to recognizing someone with perhaps anxiety or post-trauma symptoms, things like that, I remember that the ER doctors were very frustrated because they weren't comfortable prescribing medications to somebody they're only going to see one time. And I always worried about those patients and what were they going to do in the long run for their own personal well-being and higher function. But it wasn't until I was in that position as a patient that it brought me a little closer to discovering NeurOptimal, which, by the way, didn't exist here on Oahu. Let me tell you my
hey, and Gail,
quick discussion. Am I
And Gail,
loud enough?
sorry, yeah, just for those who are listening, if you could just type into the chat if you can hear Gail. I just wanted to make sure. I mean, I can hear her fine, but I know in the past we've had some issues with the sound when I'm doing Zoom in conjunction with Facebook Live. So if those of you are listening, if you could just type into the chat and just let us know whether or not you can hear Gail. And then, yeah, Gail, you can go ahead and keep talking. So,
Okay.
yeah.
All right. So it wasn't until I became a patient or someone in need, being a nurse, when I had a bad fall, and having had PTSD, post-trauma stress disorder from the 90s, but my fall was in 2017. I had a terrible fall and everything seemed to change. The bruises and the physical damage was healing on its own. I wasn't too worried about that. But you can ask my husband, my personality changed. I couldn't sleep anymore. I had nightmares. I was not functional. I would sit down on the sofa and like zone out for hours and then kind of wake up and go, how long have I been sitting here? Couldn't even cook because I'd forget what was on the stove. I mean, it was really a huge change. Being very frustrated, but also having the knowledge of psychological medications, I went to two of my doctors and I said, I need to get back to my life. My husband won't even ride in a car with me because I'm so jumpy. What do I don't want medications. So what else can I do? And two different doctors said, oh, you can try neurofeedback. Well, they didn't teach me about neurofeedback in nursing school. So I asked them, what is neurofeedback? And a neuropsychologist said to me, Gail, I can tell you what it does or what it's been known to do for people. Turn down the volume on their anxiety or turn down the volume on what is bothering them. So I said, okay, well, who do I go to? So they referred me to one of the top doctors here with neurofeedback. And I was a very compliant patient. 7 months, twice a week, I went. And I have to say, after 7 months, I got about 20% better, 20% back to my normal. 80%, I was still very, very troubled, not able to work. I won't go into all the details, but miraculously, I only left the island one weekend that year. And wouldn't you know it, someone introduced me to NeurOptimal. She was visiting Maui because someone who had a terrible accident and her son, a mother and child, had paid for this woman to come from the mainland, come to their home on Maui, stay there, and that was their recovery plan. And I thought, well, I have a recovery plan. I need to get back to my life. So I flew to Kona, and there was a wonderful doctor, more or less in retirement, that agreed to see me and treat me. And I had my first 5 sessions then. And I brought a good friend with me too that was in need. And it changed my life. Okay. How did it change my life? What's different about neurofeedback? Are we getting yeses? They can hear me, yeah, Catherine, because I saw you pause.
Yeah. And then also, I mean, part of your mouth as you're talking and leaning forward is like we can't quite see the bottom of your mouth. Yeah. So if your chair could go up just a little bit more again, or if you can move back a little bit. Yeah. Then we can see your whole face when you're talking. Yeah.
I get so relaxed. Yeah, I go into that mode, but I'll stay alert. What was different? First of all, there was no guesswork. There's a standard protocol where the 5 sensors are the same, no matter who the patient is. And in my case, I'm not a medical doctor, so I call my patients clients. They're clients of mine because this is brain training. And brain training, although it sounds like work, it sounds like sweat and paying attention, I have a surprise for you. It's not. It's passive. Your brain does all the work. And what does that look like? You sit in a comfortable chair, or children will sit at a comfortable chair and table, and 3 ear clips and 2 scalp electrodes. It's like putting a stethoscope to your head. It's not putting in any electricity. It's not putting in current. It's simply like that stethoscope that's reading your function. And in this case with NeurOptimal, it's reading your 64 brain patterns at that moment in time. And guess what? 5 minutes from now, if I put you on NeurOptimal, 5 minutes from now, those patterns are changing. Our brain is dynamic because of the environment and all the input, especially nowadays. We have so much audio and visual stimulation in our environment. So with that dynamic brain, now finally, neurofeedback has a dynamic system. And what does that mean? It changes constantly to keep up and feed your readings, your 64 brainwave patterns, right back to you in microseconds. So giving the power of any changes or shifts back to your brain. Not me, not Catherine, not any doctor. There's no manipulation, changing. And this was so different from what the 7 months that I had gone through. Because for 7 months, I call it a panic button. I had a button next to me. And if my jaw started clenching, I'd have to ring it. And the doctor would come in and say, oh, yes, I'm so glad you told me. Tell me whenever anything unusual happens. And then she goes to the computer, changes settings, comes to me, starts moving a lot more sensors than 2 sensors on the brain. And then I would hope for the best. And then I might have another side effect before the session's over. Those sessions were an hour, or a little more over an hour. So the sessions themselves seem like night and day. But the best part about it is that I could trust my brain to shift to the positive. The brain is a self-regulating, self-monitoring organ. It's just never had the technology before to give back. It's like a camera or like what in a mirror showing you your own brain function. And of course, when you're feeling lousy or not quite yourself, or you have I have ADD, attention deficit disorder myself. I only learned about it in my adult years, but all those things shift towards the positive. And that's the beauty of NeurOptimal.
And what did you see for yourself, like after you did?
What did I see?
Yeah.
I saw clarity. I saw increased focus. My anxiety, just like my friend, the neuropsychologist said, it did turn the volume down. And pretty soon the anxiety was totally gone. My husband could now ride in a car with me or drive a car. I wasn't like, shifting my head and I had this anxiety. I just unconsciously would move about, just jerking around. Besides the concentration, the peaceful sleep, and I hadn't had good sleep in months and months, was so welcomed. And well, I could talk hours on the importance of good sleep, but that was huge. I felt from the inside out that I was truly recovering and restoring from once I was. What my husband will tell you, I'm not 100% better. I'm 110 or 120% better because of the clarity and everything. I love, he made that up, but he said, it's true. You're better than you were before you even had your fall. In fact, you're better. We've been married 40 years. He says, I'm better than many years ago. So I'm very, very grateful. And of course, I can't tell my patients, my clients, exactly what I got, they'll get. But oh my gosh, the amazing things I've seen. Clients of all ages. My youngest has been 4, my youngest client. My oldest has been 90, and all in between. It's been fabulous. Yeah.
And I had a quick question for your personal experience too. I mean, like, how long did it take you to start seeing differences with the NeurOptimal?
That's a very good point. I felt calmer after the very first session. In fact, I couldn't wait to come back. The second session, because I had to fly to Kona, so I had 2 sessions in one day, a couple of days, and then another one. If someone's going to do two sessions in a day, they're supposed to be 4 hours apart. So day 1, well, the first night I slept beautifully, and I'd had 2 sessions, and the anxiety was coming down. I was thinking clearer. I wasn't nervous. I wasn't double checking things, that kind of obsessive I could relax. I could relax. I'm glad I brought my girlfriend with me because she was enjoying her benefits. And I noticed her body change, the way she held her body. She was driving the rent-a-car. We were going around the Big Island sightseeing and stuff. And I said, oh my gosh, Lisa, you're holding. And she says, can you see it? And then she thought the muscles in her face relaxed. She says, does my face look different? So you see how everyone's a little different, but it's exciting. And yes, by the third session, I knew this was my answer. And I quite honestly, I was praying because 7 months, twice a week, and not much improvement really, really bothered me. I really didn't want to go back, didn't want to go to medications. And so when I went home after 5, my husband just said, he said, we're going to buy you a system. You know, maybe you can do this for other people, you know, being a nurse. And you know what he wrote to apply for the loan for it? He wrote to his credit union, my wife deserves to be this well all the time. And that's very touched. I mean, I was very touched. And I am pretty well all the time. My coping with anything, because life is always changing and challenging you. But my coping is so much better, so much better.
Yeah.
So.
And then, I mean, just some of my observations, because you first told me about this, I think it was a couple years ago or so. And
yeah.
So, you know, and so I started referring my own patients to you just so I could hear from my patients themselves what, you know, what they would observe. I see a lot of children with autism, a lot of children with ADHD, and other patients with anxiety, depression, insomnia, various types of things. And honestly, I just have to say I've been pretty impressed with the feedback that I got. I mean, there's one patient that I referred, and they so I've been working with her son with autism for many years now, and we have tried a lot of different things, a lot of different therapies. She's tried just about every therapy you probably have heard about for autism. She's been doing therapies with her son, I think, since he was like 4 or 3 or something. And most of the children that I see with autism, you know, really improve significantly. But and he has improved definitely over the years. But I just felt like with him, I hadn't seen, I guess, as much improvement as I typically see, you know. And so I, you know, referred them to you for the NeurOptimal, and she was just saying that out of all the therapies that she's done over the years, she has done so many different therapies with her son, but she was saying that she felt like this was the most significant change she's seen in her son. And I've been working with them for many years, and so to hear that from her, that was very impressive to me. You know, so that was a really big thing. um, and I'm just going to pause here just for kind of a midway break. But so I just wanted to remind everyone that, you know, again, thank you for joining us. And what's important, you know, to keep in mind while we're discussing how NeurOptimal can help these various conditions, we'll get a little bit more into detail, but about how they can help conditions like anxiety or insomnia, depression, even ADHD and autism. Um, and so what's important to remember is that when we're working together, when I'm working with my patients, it's really a partnership for health. And my protocols and guidance added to their commitment to improving their life or their child's life enables them to be really empowered when it comes to their health. And that's, I think, one of the things that I really like about NeurOptimal is that it really is about empowerment. Um, and that means that, you know, they are able to heal their condition or their child's condition to really bring more happiness and just more balance to the whole family. Um, and for those of you who are viewing this, if you want to talk with me, you can just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. And I always want to make sure that what I do fits their needs. So you'll find all the contact information on our Facebook page, and you can also click on the link in the post. And so, you know, kind of just going back to this, I've just been so impressed that I decided to get a machine and start, you know, offering this, because I was like, I really want to offer this, you know, myself for my patients. just because I've been impressed with what patients have been sharing with me. But I know you have a lot of pretty amazing stories, and we'll have to finish up in the next few minutes or so. But, Gail, if you could just kind of give some of the highlights of, some memorable patient experiences that you've seen with NeurOptimal. I'd love to hear those. You've shared them with me.
I love telling them. A 14-year-old boy, his mother worked at the credit union where my husband took out the loan for me to buy a machine. So she kind of read his description. And when I went to pick up the check, she said, "Can you help my son?" And I said, "Well, tell me about your son." And she said, "Well, I haven't had him tested. I don't want to label him. I don't want to have him tested." I said, "Well, no, I don't care about that. Diagnosis is not important. What we want to talk about is how is he functioning? What's giving him problems?" And she says, "Oh, at school, they're always saying he can't concentrate. He just turned 14. So I believe he was an 8th grader. I remember that." And she said, "We always get the notices that he'll pass this grade, but this is still missing. So now you got to play catch up." And he didn't do. I said, "Well, does he have any interest?" "No, he's got no time for, extracurricular. He struggles so much with school." So I said, "Sure, bring him over." And there's a little video that's 3 minutes long. It's a cartoon. And he watched it with his mother, because quite honestly, the mother didn't know how to approach her son about, "We're going to go somewhere. I want you to meet this woman that does brain training." So they watched the cartoon together. And she said, according to the mother, he was teary-eyed by the end of the 3-minute cartoon because he said he could see himself in it. And just weeks before this, when I first met the mom, she said, he cried to me, "Why can't I memorize things like all the other kids? I can't remember." And he was really frustrated. And that was 3 weeks before she met me. Long story short, he had 10 sessions. Slowly, he got started with a couple very close together, and then once a week. He 8th grade was not quite finished, and I kept hearing good reports. He was doing better and better in school. And then the mother called me and said he just won. It's a big school, a big public school on the west side or east side of Honolulu. He had just won most improved 8th grader. Because in the couple of months that he was brain training, they saw so much change in him. And he was smiling from ear to ear and no problem ever getting into brain training. In fact, if mom said, "Oh, you can skip brain training this week because we've got so much on our plate," he didn't want, no, I want to go to brain training. So I find that with children, they can't describe what's happening, but usually there's no problem getting them to come to brain training because they like it. Feels good. It's relaxing. I wish I could put it in the kids' terms, but so that's a 14-year-old who's now close to a straight A student, very close, B's and A's, with 3 extracurricular activities after school. And he's very tall in sports. I'm glad he's in sports because he looks like a sportsman. I can tell you about a woman in her 50s that was on many medications for 2 depression meds, 1 sleep med that's known to affect memory, by the way. And so I would always encourage you to try to get off it. And 1 more, an anxiety medicine. Okay, a benzodiazepine. Catherine knows what that is. It can be very addicting. I worked with her. I brain trained her every day for 16 days. And after I left, she slowly got off all 4 medications. Now, I don't prescribe that. I only present the neurofeedback and NeurOptimal and let them talk it over with their doctor, let them know that they're doing this brain training. But I'm so happy to say that after decades of being on these medications and very dependent, she said, "Gail, I can't sleep without these medications." I said, "Well, I understand, I'm not here to judge. I'm here to give them an option." And it was incredible. Just the fact that she's calm. She has a big car and a small car. And she lives in Los Angeles. And she was so scared to ever drive the small car on the freeway. She said, oh no, she'd just go into a panic. She says, I'm enjoying driving my little sports car now on the freeway because she's not all in this panic mode. So her life, and of course her son is very happy to have a very calm mother compared to what she was like before. He's told me personally. Let's see. I also brain trained her son, who was about that same age, about 14, poor grades, the counselors had already told the mom, he's not college material. So be thinking of trade school or working with his hands. And it broke this particular mom's heart. But anyway, I brain trained the boy. At first, he was a little hesitant, but after 2 sessions, he would tell his mother, it's time to go. I need to get to brain training. So he was very cooperative, had his 10 sessions. I think he had more than 10. But the things that dropped away was his anxiety, his defiance. He was very defiant about ever going to bed. And I think the lack of sleep. All of a sudden, he would try new foods that the mother, because before that, he wouldn't eat anything green. And it drove the mother crazy. But now he's willing to try, and he's added a lot more healthier foods to his diet, which is always nice because you see him thriving with better nutrition, and they don't mind. It's not a struggle. He's just open. Do you want to hear about older? Well, I've told you about 2 children, and I've had some really severe cases where, they walk through the door, I listen to the history, and I think, I wonder if I can help this person. And then it turns out, oh my gosh, nobody expected such tremendous advancement. So I don't know, let's see, what else can I tell you? I recently had a 9-year-old.
Yeah. I was going to ask about that because then there was a patient that saw like some unexpected physical benefits from the NeurOptimal.
Yes.
Yeah.
Very, without going into details, very unexpected. And my very first client had a similar experience after her second session with me, and she was going for ADHD, PTSD, some heavy things that she had worked and had tried a lot of different therapies for. But after her second session, she called me and she said, Gail, I never told you about my urinary problem. And I said, oh, well, yeah. And she says, well, it stopped. And I said, what do you mean? And she says, I usually have to go to the bathroom like all day long. And she had a certain condition that demanded a urologist. She was barely 50. I think she was in her late 40s. She had tried medications for it, didn't work. And this problem, the symptoms had stopped after her second session. And she said, will they come back? They won't come back, will they? And in her case, they didn't come back. Of course, she finished out her 10, and I think she came back eventually for 5 more from me. But she's doing really well. She moved to the mainland, and she says, I want to buy a NeurOptimal and offer it to the people in her community. And so she's and that was unexpected. And of course, her PTSD and her ADHD, she's calmer, she can concentrate more. But she was so happy to get rid of the urinary problem. And her urologist said, whatever you're doing, keep doing it, because he wasn't able to quite help her over the years. So, and I've had 1, 2, 3 others with urinary problems. We don't usually talk about the urinary problems, but they've come back to me and said, do you think it's a coincidence that, and I'm smiling, right? Well, they're telling me about how they don't get up 4 times a night to go shishi anymore. From even a man came and told me, is that a benefit of NeurOptimal? I said, can be, I want to leave people with this. What does NeurOptimal do? It calms the central nervous system, which means your brain is the control. The innervation of your nervous system goes all the way down your spine and out to your organs and all kinds of things. So that's why we have this huge variety of positive symptoms and benefits. We could talk all day.
Yeah. And I think, I think one quick question that a lot of people would have is like, so after you do your initial 10 sessions, like, do the effects stick with you? And how often do you need to continue? Do you need to continue this forever? I think that's a common
Yeah.
question.
Of course, it's individualized. It depends, what their condition is. But by 10, for sure, they will have benefits, and decide, do I want to go on or not? I would say this is my third year of practice, I would say 70% say, hey, I'm good. And tell me when I might need to come back. And then I give them the short list. The short list is, if something sudden happens to you and knocks you off balance, you just don't quite feel yourself, come in early. Maybe just one session will put you right back where you were. Or somebody said, when I feel myself getting in my own way, it's like your mind is focused and wants to do something, but you just can't quite get in gear to carry it out. That's the time to come back and have a few more sessions. But there are conditions that, will take a lot longer than 10 sessions. But for those people, like I was telling Catherine the other day, I've got the letter here. This woman who I'm sure will have NeurOptimal in her life the rest of her life. She's 50 years old. She has schizoaffective disorder, bipolar type, and complex PTSD. And as Catherine knows, I've told the results that she had, which is just absolutely phenomenal. And her mother is so happy, and she's so happy. The quality of life is just improved 100%. Yeah.
Yeah, and she was able to reduce, I remember you told me about that case, she was able to reduce some of her pharmaceutical medications
Yes,
that she was
that's
taking.
true.
Yeah.
And that was a goal of hers, because she felt so drugged, was she didn't feel herself. Now she feels so much herself. She's painting for, her creative outlet that she used to do years ago. And she can finally read a book, and she couldn't do that before. So
yeah,
it's awesome.
That's so great. So yeah, so in short, I mean, so some people can do some initial sessions and then maybe just do it here and there after that. Some people, certain conditions will, like you said, will need to do it, more longer term, depending on the person. But okay, well, we're out of time, but I just want to again thank you so much, Gail, for taking the time to share your experience and your personal story. And to our viewers, I trust that our discussion about NeurOptimal has been useful for you. You're welcome to talk with me personally about any health concerns that you may have so that you can feel empowered with your health. Just call our office to schedule a free phone consultation with me. We can talk about NeurOptimal or any other concerns or questions that you have. There's no charge because I don't take patients without talking to them first. And because I always want to make sure that what I do fits their needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. So mahalo again for joining us, and thank you. We'll see you again in 2 weeks. Aloha.